So good afternoon. Today we're going to be discussing in detail how we're working with our colleagues in some of the highest risk communities to help them and us deal with COVID. And those communities are Chelsea, Everett, Lawrence, Lynn, and Revere. I do want to give a quick update first on the COVID numbers. At this point, over 2.4 million tests have been administered by the Commonwealth, and over 1.7 million individuals have been tested. Yesterday, there were over 15,000 new individuals who were tested. Testing continues to increase statewide. Last week, the Commonwealth conducted an average of about 33,000 tests a day, which is about a 20% increase over the previous week. And we continue to urge residents to get tested if you feel sick or if you feel sick or you were in close contact with someone who has COVID-19. Many of these tests can be done through our Stop the Spread program, where free testing is deployed strategically to high prevalence communities. Since its launch, the Stop the Spread program has increased testing per capita in these communities by more than 100%. We're also seeing younger people get tested at higher rates, primarily in preparation for school and for colleges. For example, last week for the 16 to 30-year-old quadrant, there were 1,000 tests conducted per 100,000 residents. That's a number that's tripled since early August. And the state's average test turnaround time for test results has continued to drop, even though we've been increasing our testing. Turnaround time for August was about 2 days. That's down from an average of 3 days in July. The Commonwealth as a whole has made a lot of progress in fighting COVID, but a closer look at the public health data shows us that a handful of communities have persistently seen higher case rates and transmission. We know that COVID can and will spread quickly in any environment if swift action isn't taken to slow and stop the spread. To take a more aggressive approach to dealing with COVID in cities and towns where cases are higher, we've launched a COVID-19 enforcement and intervention team. And these teams have been working closely with leaders in high-risk communities to help identify what's causing the high rates of COVID and how the state and they can work together. These initiatives are a partnership between our administration and local officials and include law enforcement, boards of public health, and local community organizations. Currently, our public health data indicates that Chelsea, Everett, Framingham, Lawrence, Lynn, Revere, West Hampton, and Winthrop are high-risk communities or red communities on the map. All residents in those communities really ought to stay home if they feel sick, and they really do need to get tested if they go out. No one can afford to gather in large groups in these communities. This is critically important. Time and time again, as our contact tracers have reached out to and engaged people who've become infected, gatherings, unsupervised, unofficial, people being familiar with people they're familiar with, play a major role in the spread of COVID generally in communities around the Commonwealth. People still need to remember to do things like washing their hands, and of course, they need to wear a face covering if they're going to be outside and they don't have the ability to distance. Everyone in communities that are shaded red on that map really needs to go above and beyond to do their part to stop the spread in their own community. And today we're announcing a series of new tools to ramp up enforcement, education, and public health in the 5 communities that have experienced persistent, dangerously high transmission rates. And those communities, as I mentioned before, are Chelsea, Everett, Lawrence, Lynn, and Revere. This will also include a campaign in multiple languages and will be done in conjunction, as I said, with a number of local officials as well as community-based organizations. The goal here is to make sure people understand what's going on in their community, where resources are available, and what they can do themselves to help stop the spread. It includes, among other things, a new website platform, mass.gov/stopcovid19, advertising on billboards and digital and social media, downloadable materials available in multiple languages, multilingual field teams deployed in these communities, phone and text communications, and outreach to local community groups. The new website at mass.gov/stopcovid19 will allow residents and business owners in these communities to get more information and download materials that can be displayed in their businesses, apartment complexes, restaurants, and other community organizations. People have the power here to save a life, and everybody needs to do their part to stop the virus. Secretary Sutters will go into more detail on the campaign shortly, and Mayor Rigo from Revere is kind enough to join us today to speak a little bit about this with respect to his community. I think through the COVID Command Center, we've expanded free testing resources in these communities and will continue to do so wherever needed. We've also assisted local boards of health with contact tracing resources, and we understand that many of these boards are working tirelessly, and we're augmenting their efforts. We're also addressing food security and housing needs in these communities as well, continuation of work that's been done over the course of the previous 5 months. The Executive Office of Public Safety and Security and the Mass State Police are also working closely with the ABCC and local law enforcement in these communities to monitor and issue fines to businesses and break up large gatherings that aren't in compliance with state guidelines. We've developed materials that law enforcement can distribute to groups that are not in compliance with these rules, reminding businesses and individuals of the guidelines and the potential fines associated with them.